Thank you
Yeah.
so much, Mrs. Kauthar Opeyemi Lawal. We really appreciate your presence and also for joining us on this Dose of Feminism, episode 5. We really appreciate your work, what you're doing so far in empowering, advocating, and educating women with the right knowledge about maternal mortality, and seeing your organization, Lok Natal Care, and how it's geared towards creating a safe space for women. Knowing about pregnancy, it's something that we really do appreciate. And also your partnership with NFM, I believe that it would not just be based on just two organizations coming together, but it's just going to create a very massive impact, because this issue is an issue that we don't talk about very often: women's reproductive health. And we are so grateful that you are on board for us to have that conversation. Thank you so much. My name is Friska Iwendi, and I'll be the host for this episode. So, on today's episode, we're going to go into the topic that is very straightforward: women's health myths and realities, focusing on pregnancy and abortion rights. That these are two very intertwined topics that a lot of people shy away from: pregnancy and abortion rights. So, and a lot of people are confused about having an abortion, how it is murder, and also pregnancy at the same time. So, a lot of people have different conflicting values to it. So you here on board will help us to break down how all these issues are very important for women to be aware of, and not just women, but people in society that judge women so much, particularly about abortion. So let's go into our first interview question. We want to know about your story, what drew you into the world of maternal health advocacy, and what keeps you going even when it gets tough. But before we go into that, how do you identify as a feminist?
I'm going to tell you how I, as a person, identify as a feminist. I'm a maternal and child health advocate, right? And it's not kind of, I'm also a women health enthusiast. I fight for women education, women's rights, and I also ensure that every woman has the right information and knowledge they need, especially during the reproductive health and especially during the reproductive age, with more focus on the maternal phase. That means during your pregnancy, after your pregnancy, and during your postpartum period. So I think advocating for women in that area to ensure every woman is aware and every woman has adequate information and knowledge they need during both their reproductive health and maternal health. I think that is how I identify as a feminist. You know, there are some people that will identify as a feminist in another aspect, maybe probably fighting men or doing other and
Mm.
all that. But this is the way I do it, by advocating for women's health rights and to ensure that all women, regardless of their socioeconomic status, regardless of where they come from, where they are, how they are, all women have access to maternal health, all women have access to reproductive health. So that is the way I identify as a feminist.
Okay. So also also in the sense of being a feminist, because you're also a feminist because you're not just being maybe a midwife or a nurse, but you're basically advocating for women's rights. And in our own understanding,
Mm.
feminism is also advocacy. Feminism is also enlightenment, is empowerment, and standing for what is right for women. So in a space where women are judged because of their reproductive health, especially a lot of things, especially when it's coming from the male gender, I believe you still also stand for their rights. That is why you are there to give them the right information that they need. So I believe it's still on feminism. So thank you so much. So now we want to go into your story, why you went to the journey of maternal advocacy, and how you stay motivated when the going gets tough.
Mm. All right. So let me start with how I entered the journey of maternal health advocacy. I know I tell this story a lot, and my story cannot be complete without telling that story. In 2021, I almost lost my friend due
Hmm.
to she was bleeding after birth. Had a child. That was her fourth child, right? She had her fourth child, and she didn't know that after her fourth child, her uterus, there's something we call uterine atony. right? It means the inability of the uterus to contract. Normally, when a woman delivers, like I have delivered, if any woman in the world deliver, a uterus naturally is supposed to contract, right? So that to control bleeding and our uterus can go back to the way it was before she had that baby. So, but as due to one thing or the other, as was not like that, as was unable to contract, yeah, and she started bleeding. She was bleeding out. She held my hand so tight and she was crying for help and all that. So at that stage, I was confused. I had to rush into to go and get help and all that to ensure I couldn't do anything at that period. Yes, I was in the profession, but she was my friend. She was in that phase. There was nothing I could do at that point, right? There was nothing I could do at that point. But fortunately, to God be the glory, she was rushed into the theater immediately, and they were able to help her and save her, right? So from that very moment, I told myself, assuming she was not in the hospital, what would have happened? Assuming she didn't have someone she can hold hands with, assuming she didn't have someone she can talk to at that point, what would have happened? For women that do not have access to the hospital and all that, I mean, this is how maternal mortality is high in Nigeria. And
Yeah.
right there, I decided that I was not going to any other woman pass through this. I will ensure I do whatever it is in my power to make sure I advocate for maternal health. And that was where the story started. That was when Lok Natal Care was bettered. That was when I started bringing people together, started my organization, registration. We started out with just 5 women, right? And now we have over 3,000 women in our community.
Wow.
So it's crazy, right? So that was how journey started for me. I felt like we need to ensure that no woman has to die while trying to bring out another life onto this world. So that was where the journey started, basically. And for the second question that says, what keeps me going or when things get tough? Now, anytime the journey is rough, I remember why I started. I didn't start for me. I started for other women, right? I started because I wanted to ensure that every woman that I come across with, or every woman that I speak with, either through social media or through the community entry or anything, make sure she's safe and she doesn't have a reason to die, except otherwise, let's say God ordaining or something. But every woman I come in contact with does not have to die due to pregnancy complication or childbirth complication. So anytime it gets tough, I'll just remember, oh God, Father, I know I'm not doing this because of me. I'm doing this because of this woman. I have to, God, give me the strength. I turn back to God. I tell him to give me the strength. I rely on my family. There are sometimes I'll just tell my husband, oh, I don't think I want to do this again. I'm tired. And you just be like, the reason why you started this thing. You've come too far to give up, and all that. So thank God for support system. My husband will always say, don't worry, you can do it. Oh yeah, let me take you out. Those kind of coping mechanism and all that. So whenever it get tough, because it get tougher, I wouldn't even lie to you, it gets tougher and tougher and tougher every day, because every time we have to advocate for women, every time we have to teach them on what they need to know. We have to teach them how to advocate for themselves, because there are some women who are in their husband's house and they cannot even sign a consent form to carry out a surgery for themselves. So we have to teach women how to even advocate for themselves. We have to face a lot of things every day, even in the community level. We're not just working online, we're also working with women in the community. And those are kind of the toughest kind of women to work with, because of religion, because of culture, because of so many things that they've grown with. So it becomes tougher. But when it becomes tougher, I rely on God and I remember the reason why I started out in the first place, knowing fully well that I didn't start for me, but I started for the need of others.
Oh, I'm so happy for you that you have a good support system. And then also congratulations on your 3,000 growth community members. It's a very big one. It shows how far and how consistent that you have been so far. And you spoke about community. So when we think about women navigating pregnancy today, they face real life struggles, especially those in underserved communities and those who are under-resourced. What kind of struggles do you think those such women face that we need to tackle to its roots?
Okay, so for women in the underserved communities, like I said, there are a lot of things women in the underserved communities face. That is why they are kind of called underserved communities, because one of those things is lack of access, right? I was speaking at an international festival a few days ago, and I was sharing on maternal health. And I said one of the root cause of our problem in Nigeria and Africa is that women do not have access to basic necessity. For example, when we go to the communities, in the communities, we have primary healthcare centers, right? I'm not talking of the tertiary institution or the secondary institution where they have the sophisticated equipment and all that women need to, for those that can afford it. Now, for those women in the community, they do not have access to these resources, as little as these resources, as little as an hospital bed that they can use to, the midwife can use to take delivery and other things. So there is a big lack of access in the communities, right? For example, the primary health care. The primary health care are not well staffed. They do not have the adequate staff that they need. They do not have the resources that is needed for a woman to. That is why some women do not even go there. So women would rather stay at home for the grandma, in the eldest woman in their family, to take their delivery, or a woman that is well respected in their community to take their delivery. And from there, that is where we have the high number of maternal mortality, because these women, they use unsterilized equipment. They could deliver the baby and then take razor blade to cut the umbilical cord, and unsterilized to cut the umbilical cord. The woman can deliver and they will carry an unsterilized clothes and they will tie our tubes and even tie the umbilical cord that they used to separate the mother and the baby. It's crazy. And those things by default gives infection to the mother, gives infection to the baby. And before you know, you hear that a woman just delivered, within 3 days, she's dead. Or they deliver a baby, within few days, the baby is dead, because they deliver the woman in an unsterilized environment with an unsterilized equipment. And now she's gotten infection. She's not under antibiotics cover. And then she's dying. So one of the things I really say, especially when it comes to underserved community, that is why for organization like us, we're a social impact organization. One of the things I'm grateful for that we do at Lok Natal Care is, for whatever resources we generate from our courses, our consultation, we go back into our community. We have a database of our communities. We go back, we use those funds to assist these women. Okay, where are you at the point of your ANC? Okay, you are at this phase, you are this phase. Oh, we need to equip you with medication. We equip them with medication that they will take to ensure they survive and their baby survive as well. Those that need delivery things, I mean major basic delivery things, like the razor blade, the instruments, the sterilization, we provide for them. Do you understand? So those are the things that we do at Lok Natal Care to ensure that these women in the underserved community also get help that they are not getting compared to the women in the urban society. So that access is very, very important. And as a country, we need to improve, like the government needs to improve on it to ensure that every primary health care have the right access, like they have everything, they are equipped to ensure that any woman that walk up there, goes into that place, doesn't die.
So far you've done justice to that particular question. So we want to go over to the next question because of time. So some people still view maternal care and abortion rights as opposing issues, especially the society. Society see abortion rights as a means to accept something that is wrong. So, and they see maternal care as a different angle, because to them abortion rights is about mother, and forgetting that there are a lot of things that come with abortion right. There are a lot of reasons why women commit abortion. If a child will kill a mother, you have every right to take away the child to save the mother's life. But these are the things that the society is not aware of because of how they are not properly sensitized. So we would love you if you can help us unpack the ideas about these two opposing issues, so that the society can understand more better why these abortion rights are really important for women in society.
All right, so I think when I posted our flyer for this particular interview, someone reached out to me and say, oh, how can you be talking about maternal health? How can you be an advocate of maternal health and still be talking about abortion rights? And I'm like, there are so many things you don't know. That was what I told the person. I said, let me school you, sit down.
Yes.
Now, when it comes to abortion rights and maternal health, they closely work hand in hand. And here is why. Now, for in medicine, right? As a midwife, I am a midwife as well. The law says that anything, the first person you should consider saving is the mother. If there is a battle between the mother and the child, and you need to save one person for that person to survive, and you need to choose among both of them, let the child go, save the mother. And it's not far-fetched. This is because the mother can have another baby. She can have a chance to get pregnant again, right? She can have a chance to have another baby. But if that baby kills the mother, who will in turn take care of the baby? If that pregnancy she's having, if it's complicated, if it kills the mother, who will in turn take care? Maybe either she has the child or she does not have the child. The life has been lost and it has contributed to maternal mortality. Now, where people don't get it when it comes to abortion is the unsafe abortion is where people are having problem. People think that once you go to a quack and you've removed an unsafe abortion, they will not see you as a criminal, right? And they see it that way because the government has not made abortion a right. If the government of Nigeria today, if they sign it completely in 30 states in Nigeria, that abortion is now a right, people would not see it as a big deal. People will not see it as a bad thing. However, we have to still sensitize people that you should go for abortion when there's a need for it.
Yes.
Right? You can use protection like condoms and all those things to prevent pregnancy. But when you have an unwanted pregnancy, maybe if there's any reason, it's not only married that can have an unwanted pregnancy. It's not like somebody that is unmarried that can have an unwanted pregnancy. Even as a married person, you can be married and have an unwanted pregnancy, a pregnancy that you do not want at that time, maybe due to financial constraint or your baby has not grown very well. You can't say because you have a child, you won't have sex with your partner now. It's not right. Or you can't say because as an adult, you don't want pregnancy and you won't have sex. It's not right. Do you understand? As women, we have right to our reproductive health. And when we are talking of reproductive health, sex is one of it. Right? You have right to say, okay, I want to have sex, but you should be well informed who you want to have sex with. Should I use protection? Should you not use protection? You should have those information so that you can guard yourself. But if at any point there is pregnancy and you do not want that pregnancy, a woman should be able to confidently walk into an health institution, walk into an hospital to say, I want to get an abortion done. I partook
without
in
feeling
one
judged.
advocacy campaign without feeling judged. Do you understand? So that's where one of the problem is, without feeling judged, because we have a lot of this feeling like you cannot go into an hospital because people will judge you. You get there and the nurses, you tell the nurses you want to do an abortion, you tell the doctor, they'll not look at you like this. How old are you that you want to do an abortion? I mean, is it business? No. Yeah, and that is because there is no law that covers it, or the laws are restricted. Because I also work with lawyers, right? We also work with lawyers, and I know that there's a law in Nigeria that says you can do an abortion, but the laws are restricted. It restricts people. That is why some people do not walk into an a proper hospital to get an abortion, and they regularly go to quack, and that's where the problem comes in. When they go to quack do an unsterilized abortion that can lead to bleeding, that can lead to death, that can lead to infection and all that. Do you understand? I contributed. I was saying that I contributed currently the ban in Lagos State. You can't walk to an hospital to get an abortion done. There's something in the Ministry of Health. There's something called stop policy. That is safe termination of pregnancy, right? So Lagos State, they have more like they've restricted it. That means in Lagos State, you can't walk into an hospital to get an abortion done because of the ban that they've not lifted on that stop policy. So I was among the people that contributed to advocacy efforts. We had a summit and we took it down to the Ministry of Health and say, this is what we are fighting for. We need the stop policy to be lifted. We need the ban to be lifted.
Mm.
So that when the ban is lifted in Lagos State, there are a lot of people that copy Lagos State. Once the ban is lifted in Lagos State, so many states can as well lift their ban.
Yes.
And if so many states that get pregnant that child, instead of going to a quack and dying, they can walk into an hospital to get a safe abortion done without complication and without death. So when we are talking of maternal health, there is no way you will not talk about abortion rights. Because abortion also contributes, when a woman dies abortion, it also contributes to the maternal mortality statistics. That's what people don't know. It's not only die through pregnancy that they count among the maternal mortality. As far as within reproductive health, you have pregnancy and you die through abortion, you have abortion, you abort a baby and you die. Everything is recorded under maternal mortality. So if you keep losing women from abortion due to abortion rights not said, it is hugely contributing to maternal mortality, and it's hugely affecting us, we advocates, that to ensure that we reduce the gap in maternal mortality in Nigeria,
yes,
as low as we can. Now, if a lot of men are dying from abortion side, they are dying because they can't get a proper abortion done. That means the maternal mortality will keep going up. So what is our effort? What is the point of what we are doing? What's the point of what we are advocating for? So as a maternal and child health advocate, there is no way you will not talk about reproductive health. There is no way you will not talk about abortion rights. They work hand in hand. We have to talk about abortion rights as a maternal and child health advocate. So I hope people that are listening to it, they know that. So because I'm advocating for maternal and child health, does not mean I won't advocate for reproductive health and I won't advocate for abortion right. They work hand in hand. It's a collabo.
Oh, so it's not an opposing issue. They are both intertwined. They're like brothers and sisters. So makes more sense. And it's safe to say that a lot of people are having this misconception because they are not well informed. But I believe that after this, they would have more, ideology about this abortion rights. And also, you mentioned about the stop policy. I just want to say well done because I saw that you produced, I think, a movie on the stop policy. Yes,
Yeah.
so it's a good one for Lok Natal Care.
Yeah, it's a movie on PCOS and infertility.
Oh, okay.
It's not on stop policy. It's on PCOS fertility. Yeah, or reproductive health. Yeah, channel.
Okay. So you mentioned something about restrictions, right? So we would love you to, if you've had an experience or you've heard of someone who has been restricted on abortion rights. So could you share such experience with us? Because regarding to what you mentioned
Okay,
about stop
so
policy in Lagos State.
Okay, so in Lagos State, like I said, the stop policy, the ban has not been lifted. So you hardly see women come to the hospital, they want to get an abortion. Rather, they will tell you that, oh, maybe they're probably there's something we call medical abortion. There's something that is called medical abortion. Like the doctor will not say they want to do an abortion. They'll tell you that, oh, there's something wrong with the woman. A child is probably not growing, or a child is something, or whatever. They want to get an evacuation done. Do you understand? So that one is medical abortion. So for medical abortion, it means there's a reason why they need to remove that baby medically. It means there's a medical diagnosis on why they need baby. So people use that route to kind of lie and say, oh, I want to, oh, my baby is probably not growing or whatever. And then they probably negotiate with some doctor somewhere and then they still get an abortion done. But they use the method of medical abortion, right? But people cannot come out plain in Lagos hospitals and walk into an hospital boldly and say, I don't have any medical condition. I just want to get an abortion done. No, people don't do that because of the stop policy, right? And that is what we're advocating for. Please lift that ban so that we can get a lot of people to walk into the hospital and tell us they want to get it. And then a doctor can do it. So do you understand? So we have not in recent time, we've not seen a lot of people.
Mm.
Rather, I've gotten there. Sometimes I get calls. Someone tell me, please, we want to do an abortion. Can you tell? And do you have a somebody that can do it for me? I'm like, I don't have anybody. Come to the hospital. I don't have anybody that you can do it. No, I don't. Come to the hospital. There are like women like that, but they will refuse to come to the hospital because of the stop policy. Do you understand? So that is begging Lagos State government, please, they should leave the ban so that we get more women that are free to come into the hospital, that trust us, and say, okay, I want to get an abortion. And a safe abortion is done. They are put under antibiotics cover. They go home, is well evacuated. They are not bleeding. They are fine. And then they can plan for another conception. Do you understand? So, but we've not seen women in recent come into the hospital to get a safe abortion done. Rather, they go to quacks.
And that's really bad because it simply means they're trying to police women's choices and body autonomy, which means that women in such places like that who want to go into Lagos hospitals can't even go because the government feels like maybe they don't have a choice over what is best for them. So I hope that at the end of the day we get the justice that is deserved and the policy is being lifted. So moving further, we're getting to the high point of our conversation. Some people believe that you can't support pregnant women and still advocate for abortion rights. I think we've had a conversation like this during the the fourth question. So we've already had that. So summarily, you mentioned how like they should just get more informed and how pregnancy and abortion rights are intertwined. Right? So I don't think we need to go further into that anymore. So we want to go into the care now. So what kind of support, whether family, government, or healthcare system, do you or do women truly need to feel safe, seen and heard, or supported during reproductive decisions? So what kind of support do they need?
Number one, no, would you say what kind of support, or would you rather say what kind of care? Because that support itself is one of the solutions. Do you understand? But that support itself is a solution, right? So number one, women need a supportive community. They need a community to tell them, you know what, it's all right, you're gonna be fine. We got you. We got your back. Okay, we just need to do this. We just need do that. You see, there is nothing as powerful as a community. I tell my people, and that is what women that are in our community enjoy a lot. Women in our community can literally come to the community in the midnight and drop a question, and they will get answer either from our mother's experience or from we ourselves. We have some midwives that are on beck and call that can easily answer these women. So the power of community is one of the solutions that women can have as a support system when it comes to either the reproductive health or the maternal health. That's number one. Number two is the right to access from the government. Like we say, when it comes to policies, we cannot make policies alone. At the end of the day, it is still the government that are making these policies, right? So right to access to reproductive health. Now, it is not only abortion rights that women are lacking access. Women are also lacking access of, there's something we call PAC, that's post-abortion care.
Yes.
Post-abortion care. Yes, post-abortion care. If women have this, there's a care that comes after. Some women do not also have these post-abortion care services available because of these restrictions, right? So from the government, we need access to reproductive health services like the number one, in every hospital. We need the healthcare providers to be trained on the post-abortion care services, because when women come for post-abortion care services, it means that probably they've done abortion somewhere and there's a problem. They need to, get antibiotics. They should be able to know the kind of antibiotics to give them. They should be able to know if there's a retained product somewhere, when to do an evacuation without having to judge them or without having to look at them a certain way or make them feel a certain way, these post-abortion care services done, or without giving them a bad behavior. There are some certain behaviors that they will give to them. There's some certain attitude without having to pass through all these things. So access from the government, from the family's support system, from the society support system. Then the third one is from the CSOs, the civil society organizations, the public health professionals. We have a lot of work to do as well. If the government is not doing it, we are ready to do it. How do we do it? We showcase ourselves. We showcase ourselves as a solution. We showcase our product, our services, our interventions. We showcase it to the world, either through the use of social media, through the use of storytelling, or even through the means of community interventions. So those are the ways women can get help when it comes to their reproductive health, from the family support system, from the government, access and policy improvements, and from the public health space, the civil society organization or the public health professionals. We need to also stand up and say, this is who we are, this is who we are, and these are the solutions that we are fighting for. So women need to know that, so they can know where and who they can always speak to at certain times.
This has actually very been an impactful conversation so far, and it's funny how the statements that you've been saying was supposed to lead us to the last question for this episode, where we would have asked if you're to speak directly to policymakers, to other agencies, to non-governmental organizations, what can you say to them to be able to make the society a better space, or a better safe space for women and their reproductive health? And you've given a very lucid statements on that, but we will still want to ask that question, because I believe that we want to give them just a general call for attention to these women's need. You've called the government, you've given them support, how to create a support system, the care that they need, but now we need you to use this as an opportunity to call out to other agencies, because like you earlier mentioned, Lok Natal Care can't do this all alone. So we need all hands together to help achieve this, to reduce maternal mortality. So conclusively, what words will you give to the policymakers, the agencies, and non-governmental organizations as yourself and other feminists as well, to help create a safe space for women?
Okay, so to the government, or let me say policymakers, that's number one that I want to talk about. They should make women-friendly policies. Do you understand? When I mean women-friendly policies that favor women, policies that does not tarnish a women's reproductive rights, because women have reproductive rights. Now, if you are saying, oh, don't do this, don't do that, that means you are stylishly tarnishing women's reproductive rights. You are snatching our rights from us, what we should naturally have, without having to fight for it, without having to struggle for it. You are snatching it away from us, which are our basic human rights, right? Which are our basic reproductive health rights, right? So they should make women-friendly policies that doesn't snatch away our reproductive rights, that doesn't restrict our reproductive rights, and that doesn't remove our reproductive rights away. Do you understand? In as much as I am not in support of teenage pregnancies, I'm not in support of underage children, or even people generally doing an unsafe abortion. But when they call something a right, when they call something a human right, which means when you get to a certain age, from the age of 18 in Nigeria, you are considered as an adult, right? And when they say you are an adult, you need to know the difference between the right thing and the wrong thing to be done. With that information, then nobody to snatch away your reproductive rights away from you. So I'm using this opportunity to call policymakers and the government to make women-friendly policies that will not snatch away our rights and that will not restrict our reproductive rights. So that is it for the policymakers. Then for the people in the public health space, for the professionals in the public health space, for the civil society organizations. We still have a lot of work to do. This year alone, maternal mortality has skyrocketed in Nigeria. Nigeria is now one of the leading countries in the world. It's so sad. The statistics is crazy. Nigeria is now one of the leading countries in the world with the highest number of maternal mortality. And from statistics, it has been said that aside from the pregnancy complications and the childbirth complications, the one with the highest number of the major reason or the number one cause, the one of the leading causes, let me put it that way, one of the leading causes aside from pregnancy and childbirth complications is abortion. That allows Nigeria to be unsafe abortion, that allows Nigeria to be the leading highest number of maternal mortality in the world. So it's crazy. So CSOs, public health professionals, we need to double our efforts. I need more CSOs to rise up. I need more civil society organizations that are impact-driven, that are not benefit-driven, or let me say, that are not, let's say, profit-driven. I need them to rise. I can't do it alone. 2 organizations cannot do it alone. 3 organizations cannot do it alone. But if you have more civil society organizations that are impact-driven, it will go a long way to ensure we reach more women as possible and to reduce the number of maternal mortality and morbidity rates.
This is a very, fact, I think one of the best call for attention that we really need on this maternal mortality and also advocacy on women's reproductive rights and their health. And I believe that every one of them that would listen to this would, get more triggered and more become enthusiastic to make sure that we actualize this. And on this note, we've come to the end of our conversation on this episode of A Dose of Feminism on women's health realities, misconceptions, and stereotypes on pregnancy and abortion rights. And so far, thank you so much, Mrs. Kauthar Opeyemi Lawal. You've done an amazing job in, explaining it bit by bit. You've brought it so down to a layman's level that from every conversation that we've had here, there is nobody that will listen to this that would not understand what the pregnancy right is all about and abortion rights is all about without having it mixed up. So now they are properly well informed, more educated, and they'll feel more empowered. And also, the women who also listen to this will now even feel a sense of belonging, that there are people who relate to them, there are people who care for them, there are people who love them, there are people who wouldn't judge them. And we really appreciate that. We also commend the organization for doing an amazing job, even if you can't do it all alone. But the significance that you've done so far in the lives of 3,000 women is a lot. Going through your bio, I saw how you've been able to have successfully 300 babies, healthy babies, and that's a very good one. It may not do a lot out of 200 million people, but it's a lot to save the lives of people, and we really commend that. We also commend your effort with working with NFM, and we believe that this is just a starting point to not just for now, but also for the future. Thank you once more for taking out your time to be on this episode with us. We are more than happy, and we've gotten enough insights that will impact the society and also impact our various organizations. Thank you once more and have an amazing time.
Thank you so much, Priska. Thank you.